Hi, I'm Dr. Rubin. I'm a board-certified allergy and asthma specialist, and while that previous video is very entertaining to watch and millions of people have seen it previously, it's not the right way to take an inhaler. So I'm going to go over 10 of the most common mistakes people make when they take their inhalers and ways to help correct that. So this is going to go over different types of inhalers as I talk about it, so let's get started. No particular order. First one is inhaling the medicine too fast. If you're taking a breath in too quickly, you may hear a high-pitched whistle. This is especially true if you use a spacer tube. That means you're taking it too quickly and you need to slow down your breath and make sure it's very deep. Like that, okay? Directing the inhaler at the tongue or the roof of the mouth means that you're going to hit the medicine at the wrong place. It's not going to get into your lungs. It's going to stay in your mouth. And if you're taking an inhaled steroid, that could increase the risk of having thrush, which is a secondary fungal infection. The next is making a bad mouth seal. So if you're not putting your mouth over the medication correctly, medication can leak out and not get into your lungs. Next, the tongue or the teeth could be blocking the inhaler, so you've got to make sure your mouth is wide open when you're taking it. After that, holding the medicine or your head incorrectly. So with that discus, you don't want to have the medicine tilted. It's got to be horizontal, straight up and down, and your head should be straight up and down, not slouching forward or backward. Next, not holding the breath long enough. You should really hold your breath in for at least 10 seconds or more and slowly breathe out. Next, using an MDI without spacer. So those inhalers where you click a button, you need to make sure you have a tube connected to it. For young kids, there may be a mask connected to the tube, but I don't care what age you are, it's better to use it that way because the medicine, if you don't have a spacer, is more likely to hit the back of your throat rather than getting into your lungs. Next, not shaking the inhaler. So metered dose inhalers should be shaken before you use it. The discus may not necessarily need to do that. Just make sure you're reading the instructions before using the medication. Next is slouching. So your whole body should be upright when you take the medication. Your body should not be slouching forward or backward. And lastly is using an empty inhaler. So make sure you look at the count on there before taking it because oftentimes people take it thinking that they're taking medicine, but it's not actually working. So those are some of the tips in using inhalers correctly. If you have further questions, leave it in the comments section. Like this information, share it with other people, and follow if you want to learn more about allergies and asthma.